Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Continuing Education, SOCE. Certificate Programs, Certificate in Nutrition and Childcare, CNCC, CNCC2 Organizing Childcare Services, Block-7 Organizing a Childcare Center, UNIT 29 Childcare Services in India. Historical Overview. Traditionally children were looked after by the family, relatives, village community and religious institutions. Voluntary organizations became more active in the early 20th century. Indian Red Cross Society, All India Women's Conference, Kasturba Gandhi National Memorial Trust and Children's Aid Society, Balanji Bari. In 1950s, the first five-year plan assigned the responsibility of welfare to the family, community and government. The focus was on encouraging voluntary agencies to organize activities in child welfare. ICCW was formed to mobilize voluntary activity. CSWB was established in 1953. It launched welfare extension projects. UN Declaration of the Rights of the Child was adopted. In 1960s, demonstration projects were set up in rural areas in each state to provide nutrition, health, training and welfare services. Unsuccessful due to limited resources. Need for preschool education realized. Family and Child Welfare Scheme in 1967. Children's Act in 1960. The Act was amended in 1978 to meet the needs of delinquent and neglected children. National Goiter Control Program in 1962. In 1963, the Applied Nutrition Program in collaboration with UNICEF, FAO and WHO, for production of protective foods, nutrition education of mothers and supplementary feeding for expectant and nursing mothers and children in the age group 0 to 6 years. The 1970s, National Policy for Children in 1974. Endorsed UN Declaration of the Rights of the Child. Measures included comprehensive health program, supplementary nutrition for mothers and children, nutrition education to mothers, free and compulsory education to children up till the age of 14 years, non-formal preschool education, promotion of physical education and recreational activities, prevention of exploitation of children, special considerations for children of weaker sections like scheduled castes and scheduled tribes, special facilities for handicapped children. Policy also suggested programs related to preventive and promotive aspects of child health, nutrition for children aged below 6 years, care of destitute children, daycare facilities and rehabilitation of handicapped children. Special Nutrition Program in 1970-71. Balwadi Nutrition Program, Prophylaxis Program to prevent nutritional anemia, Prophylaxis Program against blindness due to vitamin deficiency. In the fifth five-year plan, 1974-79, ICDS program was launched. NIPCCD was established. Child labor cell was set up. In 1980s, National Health Policy was adopted in 1983. National Institute for Visually Handicapped, Dehradun. Ali Yavar Jung National Institute for Hearing Handicapped, Bombay. National Institute for Orthopedically Handicapped, Calcutta and National Institute for Mentally Handicapped, Hyderabad. Child Labor Act in 1986. Early childhood education was suggested in 6th five-year plan as a strategy to reduce the dropout rate and improve the rate of retention in schools. The National Policy on Education, 1986, used the term ECE to include all activities which foster and promote the all-round balanced development of the child during the critical early childhood year. In 1990s, World Summit for Children in 1990. The World Declaration on the Survival, Protection and Development of Children. The Convention on the Rights of Child adopted by the United Nations General Assembly. Existing programs and services for children. Schemes of the government. ICDAs. To improve the nutritional and health status of children. To lay the foundation for the overall development of children. To reduce the incidence of mortality, morbidity, malnutrition and school dropout. To enhance the capabilities of the mother. Package of services, supplementary nutrition, immunization, health checkup, referral services, nutrition and health education and non-formal preschool education. Nutrition and Health Education Program. National Nutritional Anemia Control Program. Iron and folic acid tablets given to pregnant and lactating women and preschool children. National Prophylaxis Program for prevention of nutritional blindness. Large doses of VIT are given to children aged 6 months to 5 years on a periodic basis. Iodine Prophylaxis Program, Goiter and Cretinism, Iodized Salt. Scheme of Oral Rehydration Therapy Universal IMMUNIZATION Program, launched in 1985-86, against 6 major killer diseases: diphtheria, whooping cough, tetanus, poliomyelitis, tuberculosis, and measles. Funding scheme of the government for the voluntary sector. Early Childhood Education Programs Program of Creches for Children of Working and Ailing Mothers. Financial grants given to CSWB to assist voluntary organizations to run creches and daycare centers. Each creche unit takes care of 25 to 30 children of working women. Health checkup, supplementary nutrition, immunization, play and entertainment facilities. Balwadis run by ICCW, Indian Red Cross Society, Balkanji Bari, Kasturba Gandhi National Memorial Trust, Adamjati Sevak Sangh, and Harijan Sevak Sangh etc. Some voluntary organizations and innovative projects. Balkanji Bari, in 1923. Relief to orphans and handicapped children, establishing orphanages, child welfare centers, child guidance clinics, youth clubs, creches, preschools, schools and training institutes, securing enactment of beneficial legislation for children. Vikaswadi Kosbad, Balwadis run in tribals in Kosbad Hills in Maharashtra with active involvement of the community. Set up by Tarabai Modak, started a preschool training institute in 1945 at Bordi, Maharashtra. Mobile creches, started by Meera Mahadevan in 1969 in Delhi, Mumbai and Pune. SOS Children's Village of India, in 1964. Ruchika, in 1985. School for street children on the railway platform in Bhubaneswar. For children aged 6 months to 14 years. Education, health checkups and nutritional services. Child in Need Institute, CINI, in 1974 in Daulatpur village in West Bengal. Has centers in West Bengal and Tamil Nadu. Integrated services to the community including health services, supplementary nutrition and preschool education. Indian Council for Child WELAFARE, ICCW, in 1952. Balsevika Training Program for Anganwadi workers, Balwadi Cum Nutrition Program for children below 5 years. Annual National Awards, promotion of legislation relating to children and national policy for children, establish a central bureau for study, research and collection of data on child welfare work and disseminate knowledge, information. Thank you, subscribe to our channel for more updates, and we will see you with the next chapter.